the next topic of medicine. Okay, it is corticobasal degeneration. Okay, it is corticobasal degeneration. Actually, I wanted to start the USMLE series too, but this is not the right time right now because I have to complete some other things. We'll be going with USMLE soon too, but not right now. Okay, actually, it is also going to consume a bit of time. Probably from Wednesday onwards, I'll start. So let's see, but I'll definitely start it soon. I have more interest in these medicine and derma topics right now. And now, what are the clinical features in these cases? Okay. In this case, due to okay, wait a minute. In clinical features, we can divide it into two parts. First, it is due to basal ganglia degeneration. Then at the end, it can, first of all, it can be due to basal ganglia degeneration, or it can be due to cortical degeneration. It can be either due to basal ganglia degeneration or due to cortical degeneration. And due to basal ganglia degeneration, okay, we can learn the symptoms from over here. There can be bradykinesia and rigidity. Okay, bradykinesia usually means slowness of movement. Yes, it means slowness of movement. And rigidity, how do we define rigidity? It means increased resistance to passive movement of the joint. Okay, rigidity is the increased resistance to passive movement of the joint. Bradykinesia and rigidity, they are usually asymmetric, but they are present due to basal ganglia degeneration. Now, due to cortical degeneration, what do we have here? There can be cortical sensory deficits. Okay, such as tactile localization or stereognosis is lost. Such as tactile localization or stereognosis is lost in cortical degeneration. Okay, there are cortical sensory deficits. Okay, in cortical degeneration, there are cortical sensory deficits such as tactile localization, stereognosis is lost. Now, what is stereognosis and tactile localization? Okay, stereognosis is the ability to recognize and identify objects by touch alone without the help of vision, whereas in tactile localization, it is the ability to identify the exact point on the body where a tactile stimulus touch has been applied. Okay, in tactile localization, we touch any part of the body, and then the person is told to locate where the position where that person was touched, and this is known as tactile localization. And in stereognosis, there is tactile localization, and in stereognosis, the person is handed over any random object, and the person is told to identify the object by touch alone without the help of vision, by eyes closed. Okay, first basal ganglia degeneration, then we saw cortical degeneration, apraxia. Then coming to apraxia, we have idiomotor apraxia. In apraxia, we have idiomotor apraxia. Okay, due to cortical degeneration, cortical sensory deficits such as tactile localization or stereognosis, it is lost, and in apraxia, there can be idiomotor apraxia. In idiomotor apraxia, it is the impaired ability to perform a skilled gesture with a limb upon verbal command and or by imitation. Now, idiomotor apraxia is also seen due to cortical degeneration. It is the impaired ability to perform a skilled gesture, okay, with a limb upon verbal command and or by imitation. If a person, in this case, for example, a person A is told to do some kind of work by any kind of verbal command by the person B or by any kind of imitation, then the person is unable to perform that skilled gesture with the limb. Then we have myoclonus. We covered this topic fully in seizures and epilepsy. Okay, myoclonus. Now myoclonus is a sudden brief involuntary shock like muscle jerk caused by synchronous or asynchronous contraction of one or more muscles. Okay, it is rapid and jerky, unlike tremor, which is rhythmic. Okay, now we have the alien limb phenomena. Alien limb phenomena. Till now, in cortical degeneration, we studied cortical sensory deficits such as tactile localization and stereognosis, apraxia, investigated apraxia was seen, myoclonus, and then we have alien limb phenomena. It is present in 60% of patients. Okay, it is usually present in 60% of patients, the alien limb phenomena. Usually, the cortical degeneration is all related to the sensory system only. Now, there can be involuntary motor activity of a limb. Involuntary motor activity of a limb in conjunction with the feeling of estrangement from the limb. From the limb is there, okay? In alien limb phenomena, it is present in 60% of the patients, okay? And involuntary motor activity of a limb in conjunction with the feeling of estrangement from the limb. Okay, now there can be involuntary motor activity of a limb. Why? Because the limb wait a second. So involuntary motor activity of a limb in conjunction with the feeling of estrangement from the limb in corticobasal degeneration. Okay, so this is a really tough line to understand. This means that the limb, usually the arm, it performs involuntary, purposeless or goal directly movements such as touching the face, unbuttoning clothes, okay, or opposing the other hand actions, okay, such as touching the face. But the person, it feels like that limb does not belong to them. There is a sense of estrangement, okay, foreignness, involuntary motor activity of a limb in conjunction with the feeling of estrangement from the limb, and it is also associated with it is associated with tactile Mitgehen. Now, what is the meaning of tactile Mitgehen? It means it is a rare motor phenomenon in which a patient's limb moves passively and smoothly in response to the light touch or pressure without any resistance, even when not instructed to move. Okay, tactile Mitgehen. Okay, in case, for example, I am an examiner and I touch the patient's arm slightly like this, then then the arm further it follows tactile Mitgehen phenomena, even though I am not interested in flexing the arm at the elbow joint. Now coming to the so till now these were all the features. Just summarizing, due to basal ganglia degeneration we have bradykinesia and rigidity which are asymmetrical, and due to cortical degeneration we have cortical sensory deficits such as tactile localization, stereognosis, it is lost. Apraxia, there is idiomotor apraxia, okay, cortical sensory deficits, tactile localization, stereognosis, apraxia, idiomotor apraxia, myoclonus, and alien limb. Alien limb present in 60% involuntary motor activity and associated with tactile Mitgehen. Now till now these were all the clinical features. Now what is corticobasal degeneration? How do we define it? Now coming to the definition. It is a type of atypical Parkinsonism only. Atypical Parkinsonism only, and it is included in Parkinson plus syndromes, that is extra pyramidal syndromes plus degeneration of cortex is also seen, that is in parietal lobe, frontal lobe, and to some extent occipital lobe. Okay, it is a type of atypical Parkinsonism and it is included in Parkinson plus syndrome, that is EPS, extrapyramidal syndrome plus degeneration of cortex, that is parietal lobe, frontal lobe, and to some extent occipital lobe is also there. There is EPS and degeneration. It is a neurodegenerative disorder which is caused by 4R isoform taupathy. Taupathy is the accumulation of tau proteins in the brain, and 4R isoform is the pathologic form of the tau proteins which is getting accumulated in the brain. It is a neurodegenerative disorder caused by 4R isoform taupathy, again extra pyramidal syndromes plus cortical features in the age range of 50 to 70 years is seen. Now coming to the diagnosis. It is mainly based on the clinical features only. It is mainly clinical only. And MRI, it shows the atrophy of basal ganglia plus cortex. Okay, MRI shows atrophy of basal ganglia plus cortex. MRI shows atrophy of the basal ganglia and the cortex. PET CT scan. PET CT, it shows decreased metabolism of basal ganglia plus cortex, and SPECT shows SPECT shows decreased metabolism of basal ganglia plus cortex. Now coming to the management. In management, there is no disease modifying treatment available. Diagnosis can be done, but there is no disease modifying treatment available, and only supportive care is possible. Now a question. Coming to a question. Okay, anarchic. Now the question is anarchic hand. Okay, anarchic hand phenomena is seen in FTD, BCBD, corticobasal degeneration, C-part PSP, DAD. Okay. Now, first of all, what are these? Okay. FTD is frontotemporal dementia. CBD is corticobasal degeneration. PSP is progressive supranuclear palsy, and AD is Alzheimer's disease. Okay. Now, what is an anarchic hand or alien hand? Okay, anarchic hand or alien hand. We studied this earlier over here. Alien limb phenomena. Okay, an alien limb phenomena. It is seen in when alien limb is related to some specific organ such as hand, then it can be called anarchic hand. Okay, it is, so the correct option is CBD. It is another name for alien hand phenomena. The most common answer is CBD. It can also occur in other diseases. And we'll soon be starting the USMLE series 2. Besides this, we are over with corticobasal degeneration.